Over the years, treatment for ankle arthritis has evolved, and more recently, more and more designs have come up specific to ankle replacements that I think are more amenable to treating patients today. So years ago, they had designs that I think were not a great design. They tended to fail, and more recently, there's been a lot of research and a lot of effort into making the ideal implant for patients. Having said that, not everybody is an ideal candidate for an ankle replacement. So someone who's in their 60s or older, not obese, relatively healthy individual who wants to play golf or doubles tennis would be an ideal person for an ankle replacement. Most people are familiar with knee replacement surgery. It's essentially that type of implant that we've downsized, to put it simplistically, that goes into the ankle. So we typically make the incision on the front of the ankle. You're in the hospital overnight. We put the implant in, ease into the weight bearing, usually starting at about 2 to 4 weeks, depending on the bone quality that we see intraoperatively. But it is a pretty quick recovery by and large. It's about half the recovery time as an ankle fusion in my experience. The average patient, if we can get 15 years out of an ankle replacement, I would say that's a good outcome. The further away you get from the core of your body, meaning the further away from the center of your body, there's more joint reactive forces going on. So the rule of thumb is for every pound up above, it translates to about 7 pounds of pressure through the ankle and about 4.5 pounds of pressure through the knee. So over time, even in ideal circumstances, the ankle will wear out. I've done ankle replacements on people as young as mid-50s, and I tell them this is not going to be the last surgery they get in their ankle. Now, if somebody's in their 70s or 80s, it may be, and it all depends on the activity level they choose to pursue and the other variables such as weight and other comorbidities that they may have. But if we can get 15 years out of an ankle replacement, that would be great. A lot of times it's just a matter of exchanging the piece of plastic, which generally speaking is a relatively easy procedure. But if we have to exchange the metal implants, then it becomes a much bigger deal.